Just hours after two local professors talked about the one industry that's keeping the recession from being worse. 24-Hour News 8's Tony Tagliavia live on the Medical Mile with that angle.
Good evening, Brian. Those GVSU researchers released this statistic today that this decade, West Michigan's healthcare industry has generated nearly half the jobs West Michigan has lost in manufacturing.
The researchers who will fill this lab space at the Van Andel Institute will continue that trend.
Carriers, we will.
And a report from GVSU's Paul Isley and Harry Singh shows the VAI topped the list for patents in the healthcare industry in West Michigan in the 2000s with more than 25. Those patents can grow the region's economy beyond giving researchers jobs. They can give local manufacturers something to make.
We can take advantage of both of our strengths here.
There's some anecdotal evidence of that happening, Isley says. He says West Michigan is better positioned to grow its healthcare industry than the rest of the state, and he says the region is better positioned than most other communities around the country. But the man behind the research points out healthcare can't do it all.
To replace the manufacturing base that we had in Michigan is going to require more than one industry, and it's going to require thinking about those industries in ways that haven't been thought of in other parts of the country.
Still, the health industry can be a part of it, and GVSU researchers also looked at whether West Michigan is ready to fill the jobs that the industry will create.
And we find some striking results.
Singh expects the regions to have too many veterinarians. For other fields, it's the opposite.
There's going to be a shortage, a significant shortage of nurses.
Of the healthcare industry and the economy is not always positive. Researcher Singh was talking to us about the trends that have driven up costs in West Michigan. He says the top three are low birth weight, excessive drinking, and obesity. He says if this state can just hold on to the current obesity rate, not cut it, but just hold on to the current rate over the next 8 years, the savings could amount to $7 billion. Live along the Medical Mile, Tony Tagliavia, 24-Hour News 8.